I'm Dr. Chase Hayden from the Hayden Institute, where we help our patients to be healthy and well without the use of drugs and surgery. We've recently talked about the importance of gluten sensitivity and testing for it, but also how you can be negative for celiac disease but still have a gluten sensitivity issue. Oftentimes when we think of gluten sensitivity, the first condition that comes to mind is celiac disease, but it doesn't always have to be that way. In the Journal of Neurology, Neurosurgery, and Psychiatry, there's an editorial article that talks about how gluten sensitivity is also a neurologic condition. Gluten sensitivity has the ability to affect many different neurologic pathways in the body. And for some individuals that have neurologic conditions, such as ataxias, where there's difficulty in walking and in balance, peripheral neuropathies, where there's loss of motor aspect, where they can't move, or loss of sensation, these different neuropathies, these ataxias, dementia, headaches, are many conditions that have been associated with gluten sensitivity. In fact, in this editorial, in the Journal of Neurology, Neurosurgery, and Psychiatry, it talks about idiopathic peripheral neuropathy. What that basically means is idiopathic, nobody knows where that's from, so it's an unknown origin or unknown cause, peripheral neuropathy. They find that about 40% of those individuals, based off of the survey or based off of the research article that was written, have gluten sensitivity, which means they took their blood on these individuals that were not complaining of digestive concerns. They didn't have constipation, digestion issues, diarrhea, bloating, gas, anything, but they had these neurologic conditions of peripheral neuropathy. They didn't know what had caused it. They drew their blood and they found positive antibodies to gluten. Additionally, they also found patients that had idiopathic sporadic ataxia. Idiopathic means, once again, they don't know where it's from. Sporadic, as in it comes and goes, and ataxia is loss of balance in walking. So they basically walk like they're drunk. And so they have this gluten ataxia is what it's now being known as. 143 patients were tested for gluten sensitivity that had these idiopathic sporadic ataxias, and 41% of them had gluten sensitivity. Once again, without digestive issues, we can still have gluten sensitivity problems. So if we have a neurologic condition, headaches, unexplained pains, ataxia, peripheral neuropathy, and even dementia, there could be a correlation between gluten sensitivity. And the best way to find out is to do the test. We run a blood test in the office wherein we're able to look and see if there are antibodies present to gluten that can also be triggering a neurologic response, even if there's no celiac disease present. In our office, we recommend Cyrex Labs, which is a lab that tests more than just the celiac markers. We're able to test gliadomorphins, transglutaminases, alpha-gliad, and a wide variety of different portions of the wheat molecule in order to get the best idea as to what could be contributing to your neurologic symptom. Once again, gluten sensitivity can be a neurologic irritant, so therefore we want to test to find out what's going on if we've got a neurologic condition that's not getting better with our traditional approach, whether it's drugs or surgery, medications, supplements. If something's not getting better, we want to look and see why it is and what the true cause of that ataxia or that neuropathy or that neurologic condition may be. And it may be that in your case, gluten sensitivity is what's doing it. Once again, I'm Dr. Chase Hayden, and I'm an alternative doctor here at the Hayden Institute, where we help our patients to be healthy and well without the use of drugs and surgery.